Hi, this is Dr. Surbjit Herr, your community wellness chiropractor with your weekly wellness tip. And what I wanted to spend some time discussing today is the difference between what we call wellness care and sickness care. What we call healthcare in Canada, in reality, is sickness care. In other words, you ignore your health, you get sick, you go to the doctor to get better. The doctor takes care of you via drugs, possibly surgery, and these treatments here are designed to manage the symptoms. Never really truly address the cause of your health problems. And I'll never argue this fact that, if you break your leg, you sever an artery, we're very fortunate to have a very great, what I like to call more so a crisis care system. When you're in crisis, they can patch you up, get you back together, and get you on the go. But think about this. When do you get to use your extended health care insurance? It's actually when you're sick. So let's talk about some of the differences between wellness care and sick care. Well, in wellness care, you're treating symptoms by addressing the actual underlying cause of the problem. Where in crisis care, you're masking or suppressing the symptoms, but you do not address the underlying cause. Also, when you're in wellness care, the treatments are designed to have mild or no side effects, other than, some very minor things. But in sickness care, treatments often have serious side effects and complications. Even in a study done by Dr. Bruce Pomerantz, a medical doctor based out of Toronto, that estimated that as many as 24,000 people die each year due to the adverse effects due to prescription and non-prescription medication. That's 2,000 people each year. Also, in wellness care, the patient is empowered, educated, and encouraged to play an active role in the healing process, where in the crisis sickness care model, the patient is actually treated as a victim. And discouraged from playing an active role, not educated about their health problem, their conditions, and how to manage it. And this brings me back to a time where I had a patient after an adjustment that got up and said, Dr. Herr, I wanted to tell you something, and I've just been diagnosed with cancer. And I said, well, I'm very sorry to hear that. So, what are you going to do? What are you going to do to help your body become healthier so that you can fight this thing? And she said, well, I kind of asked the doctor the same thing and said, is there anything I can do nutritionally to help? And the doctor said, well, there's nothing. And I think you and me can both agree that a lot of cancers can be caused by nutrition. So why not use nutrition to help fight cancer off? Other difference between wellness care and sickness care is in wellness care, we view the whole body as an interconnected, vitalistic whole and recognize the importance of the connection in health and disease, wherein sickness care views the body as a collection of separate parts, right? Each separate part of the body has their own specialist. A heart doctor is a cardiologist, and you go to see a specialist when you have a certain health problem, versus when you're in that wellness care, we're looking at the whole body together. And the big thing to me that I think there's a fundamental difference between the two systems is in wellness care model, you're focused on preventing disease before it actually occurs, where in a crisis care model, you're focused on managing the disease and the symptoms long after it's occurred. So I just wanted to spend some time, speaking to you about the differences between, what I believe to be a sickness care model, a crisis care model, and that of a wellness care model. So, think about what we spent some time talking about today, and I encourage you to send me questions so that we can discuss these on the wellness tips of the month. This is Dr. Surbjit Herr, using the power of a wellness chiropractic lifestyle to help change and transform lives. Take care.